Things ain't always what they seem. We all know that from life, right? Of course, proven time and time again. But in a clinical setting, that is extremely important to remember. And if you're a prospective patient of Wend Wellness or any chiropractor, any doctor that you go to, you got to realize that what you think is the problem may very well not be the problem. There might be some underlying cause that is much more or even less serious sometimes than you think. And I want to supplement that with a few examples of patients that I have seen in my office. Obviously, we ain't going to tell you the names, because that'd be a HIPAA violation. Ain't going to be doing that. But we'll tell you the cases. And one I just saw about 30 minutes ago was very interesting. One relatively recently was somebody who had chest tightness, difficulty breathing. They wanted a thoracic adjustment. They'd been to a chiropractor before. They had previous imaging. They didn't find anything. It was a couple years ago, many years ago actually. And they said, you know what? I go to chiropractors. I said, you know what? Look, let's do an exam, this and that. And they had positive Valsalvas, which is like, and squeeze. If you have a space-occupying lesion that could bother you, it could be a disc, could be scar tissue. It could even be, a strain would hurt if you do that. But it could even be something like a tumor. And guess what? I sent them for imaging and an x-ray, and we found a pancreas tumor in the apex of their lungs. Oncologist, right? I've had somebody that had pain in their right shoulder. They didn't quite know why they had pain in the right shoulder. All the muscle tests were negative, all that stuff, sensory exam, everything like that. Didn't make a whole lot of sense. Some of the doctors didn't know what was going on. And what did we find? Well, we asked the question, does it hurt more after you eat? Is it any worse? And so, oh yeah, actually, I noticed that. All right. So what do? We send them for imaging, and they have some gallstones in there, right? Gallbladder stones, right? So we send them to the appropriate doctor. And so, today I had somebody that had numbness and tingling up here. They had no muscle weakness. They can move it just fine, right? Their neck's a little stiff. Their ranges of motion, pretty decent. A little bit of discomfort, right? They had some medical history other than that, right? Otherwise, high HbA1c, and they had hyperreflexia, bicipital reflex, and so, they're being sent to a neurologist, of course, is what I would do at least, and that's what I did, because it could be an upper motor neuron lesion between the brain and the spinal cord. But what was going on there? Was it right to treat him today, send him for imaging? What's kind of going on? So I said, you know what, we'll do something palliative today, and we'll try to give you some relief, and I want to get to the bottom of this, and let's see what's going on. Right? They also had some eye twitching, was very strange, and what's happening here? Cranial nerves checked out, facial nerve was fine. All you got to really do is smile. Maybe, they stuck their tongue out, they fought the cardinal fields. Again, all these things, accommodation reflex, all that was normal. And they could wrinkle their forehead and this and that, right? No pain or numbness or tingling coming down the whole arm. It was just like right here in the upper trap. So I said, all right, well, let's think about, what innervates, what nerves travel to that. And let's see if this is coming from the spine maybe, because she had been to a bunch of other doctors. I mean, a lot. And nobody knows what's going on, right? She had even, been to orthos and all these people. I'm not saying, better do. But it's, the patient's in the middle, and every doctor is a piece of the pie, and we're all trying to figure out what's going on with you, right? And so what she had going on, again, was some numbness and burning and tingling right here. But the motion was fine. It wasn't as much pain. The burning was very slight. She couldn't quite get rid of it. So what is happening? So what I thought right away is, all right, if her motor movement's fine, that's the spinal accessory nerve is going there. That's a cranial nerve, right? And it originates in the medulla, the nucleus accumbens, and it travels down, and it goes to meet another nucleus. It's actually the nucleus ambiguous, I believe, if I remember correctly. That was a while ago. But I knew that it originated in the medulla, right? It's the nucleus ambiguous, actually, what it is. Nucleus accumbens different. But anyway, the names don't matter. It goes down, and it, at the level of the cervical spine, okay, it exits at the accessory nucleus. It goes there, and then it travels into spinal nerves. And there are two routes. It can go and meet the vagus nerve if it comes up through the cranium, the cranial portion, and the spinal portion goes to the trapezius, right? And it controls motor movement, but the motor movement was fine. So what's causing sensation that goes from there back to the spinal cord and to the brain? That would be more responsible for some numbness and tingling and burning, things like that. Well, that's actually the ventral rami of C3 and C4. So we got a little spine right here. So you see C1 right here, right? 1, 2, 3, 4. These nerves right here, okay? So those nerves, there's a nerve coming from the trapezius going to them, sending signal up to the brain. And I said, let's see if there's anything wrong with that. So we did some muscle work first, And then I checked to loosen up the muscles because the nerve could also be compressed in the upper trap. It could be the trap's really tight and it's compressing the nerve, right? It could be a lot of things. And so I checked the neck, and guess where she was really stuck? Meaning the bones were fixed and misaligned. It was right on that side, and it was right at that level. And it's just amazing. So what did I do? I did an adjustment. And what happened? It went away. And that's incredible. Will it come back? Sure, she'll go do all the same thing. I hope not, but it's not a one-time fix. It's typically chiropractic. It takes time. We did a whole video on that. It's with many things, nutrition and with fitness. Everything takes time, and you have to be patient, right? But especially if it's a problem that's come on over 30 or 50 years, and you can't expect to be fixed in one day. But this was very fascinating because that is relatively rare that in one day, it's just kind of, people feel better all the time. Every patient really that leaves feels better, 99% of them, right? But, there's outliers for everything. But the fact that the symptoms just went away is just so fascinating, and it's not always what it seems. She thought it could have been all these other things. And, she's a gastroenterologist, right? She knows the body, but, not in the sense of chiropractic. And chiropractic was something she hadn't tried yet. And she had gone to people that had just done, basic muscle work and also other tests and all these things. And they're giving her medications, and they weren't working. But isn't that so neat? And I just had to share that with you guys as an example to show it's not always what it seems, right? Things are not always as they seem. Make sure that you get checked. If you have an issue, especially one that's been progressing or lingering for some time, it's been getting worse, right? And it's interfering with daily activities. You have any sort of neurological symptoms or anything like that, or symptoms really anywhere in the body that's going on that aren't resolved, go get checked out. And a chiropractic office ain't the worst place to start most of the time, right? Of course, if you, bleeding from the head, don't come to a chiropractor, go to the ER, right? I'm not going to patch you up in here this way. But, it is true. Dave, what's up? Beast from the East. How you doing? Frank, how are you, my friend? Kevin, what's going on? Ma, I love you. Thank you. Nanda, Alexis, thanks for the support. Sabia, hello, baby. Happy Saturday in the office. We were just treating patients in the other office. Tommy Reed, Realtor. Appreciate you guys. So, before we sing happy birthday to Victoria, because it's your birthday, girl, I'm going to sing to your ass. You already know. Sing to everybody on their birthday. People that we know and people that we love, people that we care about. And you're one of them. So, hope you have an amazing day. But before we do that, we were on the Donna Drake show this morning, man. It aired at 6 a.m., you guys, on Saturday. I didn't even post anything about it. Nobody's awake at 6 a.m. on Saturday except for the 7.5 million households that it airs to, which is pretty cool. A lot of people actually get up early on a Saturday, apparently. But, if you guys want to see it, I'm going to post a link to the video so that everybody gets to see Wend Wellness on TV, because it was fun. We did all right, but it was a fun experience. I want to share it with you guys. So I'll post that at some point. But as for now, we're not ready to go yet because it's time for happy birthday. Happy birthday to you. Happy birthday to you. Happy birthday, dear Victoria. Happy birthday to you. So many more, baby girl. Hope you have the best day. Say what's up to Matty Boy. Maybe he'll see this too. If he has Instagram still, he might have deleted it. I'm not sure yet. I don't even know if you have it. Maybe you won't see this and I just sang to nobody. But if not, happy birthday. This one's for you. You're taking the book of Wend Wellness. So say what's up to little Odie too, the little cutie pie. My nephew who I can't wait to meet. And John B. Bonbon, thanks for coming on, man. As for now. So we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Don't move your neck around like this. Have a great rest of your day. And happy Wend Wellness. See you tomorrow, baby.